I swear every cardiologist references the AFFIRM study, so it must be important. Let's break it down. AFib is the most common sustained cardiac arrhythmia. Symptoms are due to poorly controlled or irregular ventricular rate. Plus, patients have double the mortality risk. But what's the better treatment for AFib? Rate or rhythm control? Rhythm control decreases symptoms and stroke risk by maintaining sinus rhythm by cardioversion or antiarrhythmics like amiodarone. However, AFib is often poorly responsive to this approach. An alternative approach is controlling ventricular rate by using AV nodal blockade or ablation and pacemaker insertion, but anticoagulation is more important with this approach. The AFFIRM study compared these two strategies. Patients initially in the rhythm control group had high rates of crossover to the rate control, which is consistent with the notion that antiarrhythmics often fail. The AFFIRM study found that mortality was slightly higher in the rhythm control, but didn't reach statistical significance, with no difference in stroke, bleeding, or cardiac arrest. Rhythm control had an increased number of hospitalizations and had a higher risk of mortality in these subgroup analyses. In summary, there is no clear advantage of rate versus rhythm control in overall mortality or stroke risk. However, hospitalizations were greater in the rhythm cohort.